Q Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day, everybody. I'm Jason Salas here on location, and thank you for starting your day the KUAM way. We have got a special live stream for you this morning because about a week and a half ago, you may recall, we live streamed on a Sunday from the Public Health Laboratory up in Dededo, otherwise known as the Mosquito Lab. And the work continues to fight the bite. We are here in Mangilao at Public Health's headquarters in the central part of the island. We're going to go take a look at this facility's lab, tell you how various diseases are being classified, how they're being fought, and what your government is doing to make sure that you can steer clear of some of the health care scares, particularly the dengue infection, which has been alarming our island for the past few weeks. Just to get you up to speed on where exactly we are with that, as of last night, there are no new cases of dengue to be reported. At this time, I believe there have been 8 reported so far. And we've got some officials right here. So, half a day, ladies. We're live on Facebook right now. Thank you for having us.
Good morning. Hi, half a day, everyone.
Okay, so
Welcome to the Guam Public Health Laboratory.
all right, thank you very much. What type of facilities are you going to be taking us through today, and specifically, like what types of procedures and techniques will you be discussing?
Well, right now, okay, the laboratory, we have different sections here. We have urinalysis, bacteriology, tuberculosis lab, HIV, STD with serology. But mainly today, we'll be showing you our dengue PCR testing lab. And Alan Malari is the microbiologist that will take you through that technical process.
Okay, Alan. Hi, half a day. Thank you very much for having us. I'm Jason with KUAM.
Yeah, welcome to Guam Public Health Laboratory.
Okay, so when patients that have been known to contract a dengue infection here on island, how do you actually make sure that you can verify that sample, and like what types of tests do you do to verify that?
Okay, our dengue here, we have serotype. We can detect 1, 2, 3, and 4. So this is a CDC kit that came from CDC. So we're using it here in the island. Yeah, I'll show it to you where our testing is done in BT room.
Okay, and just real quick, what types of materials are you testing to confirm the presence of dengue? Is it saliva, blood tests, urine?
We use serum or blood samples.
Okay, blood samples. Okay, very good. Yeah. Please, sir. Okay, so once again, if you're just joining us, we are live from the Public Health headquarters in Mangilao. Our friend Alan, a technician, is taking us into a very secure area. It's very, very cold here. Climate control, of course, Alan, to prevent the spread of bacteria.
Yes. So we have 3 rooms, and this is our clean room where we set up our probes. So we can set up what target probes we have. So if we're looking for dengue 1, dengue 2, dengue 3, and we can do it here. So on the second room here, we extract the RNA. So any specimen comes here, we take the RNA through those samples. So from that area, from that room, the probes and the RNA, we put them all together in our PCR room. So we can bind them together, and then we put it through our PCR machine. So our PCR machine is a polymerase chain reaction, and that machine can detect or can multiply the RNA. And then detect what kind of virus it is. It is 1, 2, or 3, and 4.
Okay, Alan, what is the typical turnaround time for when you begin a test and then when you can actually verify the data as actually being dengue?
The actual test itself, it will take around like 6 to 8 hours. But we are trying to put it like in 24 hours that results will come out. But we are so lucky, usually a day, the results go out already. Yeah, so lucky we have this kind of testing in the island, so we can have right away the results within 24 hours. So it's so important to our surveillance team to respond right away, and the vector team to do their controls for the mosquito. Among all the islands itself, the other islands, they send their sample through us, and it takes like a week before the results come in. So we are just so lucky that testing itself, it's done here. So right away, the surveillance and the vector control is really impact us.
Okay, so maybe to allay the concerns of the community right now. So, Alan, you would say that your staff, even though this is the first time dengue has been in existence in our island in 75 years, 7.5 decades, dengue has not been here, but we do have confirmed cases right now. Your staff is by no means inexperienced in this. You're well aware of the procedures and you do testing for, as you said, the other outer islands.
Yes, we are really prepared for this one, and we are so lucky that CDC gave us all this equipment. And the proficiency itself every year it's being sent to us, so we can say we are accurate with this testing.
And just for people that may not know, we've been reporting this, as all of us in media have, is dengue is not an airborne disease, correct?
No,
Okay.
no, it's just transferred through mosquito. So it's safe to say, and most of the testing right now are all negative, so we are really in control, I think.
Okay. So as far as with respect to the clean room and everything, can you explain, the gear that you have on right now? Because the reason I was asking, is it airborne and everything? I'm sure that makes you feel a lot better because you're dealing with these, with these bacteria and this type of material, basically like first-person hands-on and everything. So how do you have to prepare yourself when you're going through your test?
This laboratory is a BSL-2 laboratory. So when you say BSL-2 laboratory, you have all the equipment for PPE, from masks to lab gown and gloves, double gloves. And basically those 3 rooms are restricted for technicians only. So whatever you use in that room, you will not go out. It will go to the biohazard. And here we have a biohazard for autoclaving. So all the biohazard is being already burned here. And biohazard itself is really the main focus here.
How many members are on your team, and what are your typical hours of operation? Are you a 24-hour unit?
Right now we are running all the tests before we. It's like we're running twice a day, so we can run 17 samples in each batch. So by the time we leave in the afternoon, all testing are done already. So whatever comes in the afternoon or at night, it will be run in early morning. So doctors receive it by end of the day.
Well, what else are you able to show us, Alan?
Okay. This is the PCR room, and where the extractions. This kind of PCR machine is the only one in the USAPI. So
What is USAPI?
it's affiliated of United States territories.
Okay.
So Saipan or
So it's the only one in the region?
Yeah, CNMI, Palau, and Yap, they send their sample to us here. So it takes them few days before they get the results, not like us.
Okay. How many tests are you guys capable of doing in one day?
We can do 17 samples in batch. We can do double batch in a day. So we're looking of like 34 samples in a day we can run. Yeah.
On average, since this dengue situation on island started, how many have you guys been doing a day?
Right now, I lost track already. It's the surveillance team or the team that for the dengue in Guam Public Health. That's the one who got all those numbers. Right now, whatever samples come in, test right away. Yesterday in the afternoon, we released like 17 samples. Today we're gonna run the first batch again. So we're looking at 3 o'clock. Results will come out again.
Now, I'd like to ask you, Alan, a question that I asked with your colleagues over at the Dedido Lab. What prevention measures do you have to make sure that, like, when your equipment and the computers spit out like a particular sample may test positive for dengue? How can you make sure that that's not a false positive, or maybe even more alerting, like a false negative? Do you have like a double check system that can verify that it actually is dengue?
CDC is strict in their SOP. So whatever testing I'm doing here is basically the SOP of CDC. So there's a certain protocols. In each batch, you have to run like 4 controls. One of the control is out, you have to repeat all over again. And this laboratory is under CLIA, so there is a yearly inspection on it, and we have quality control systems that each batch has to pass the controls. There's no way that we release the results that is not pass the control. We can always repeat the testing.
So CLIA is like a standardized, it provides standardized guidelines, and they ensure that you guys are keeping up with those on an annual basis.
CLIA is a regulatory body for Medicare, public health for United States. So any public health, any laboratory in the United States has to pass the certain criteria for CLIA. Without CLIA license, you shut down the laboratory. And each test that we use here are FDA approved. We cannot use a non-FDA approved or emergency use approved from
How long have
FDA.
you guys been CLIA certified?
That one I need to check. It's since I came here, we are always CLIA certified. Yeah.
Right. How long? have you
Okay,
guys
so public
been
staff is actually saying the lab could not actually be in operation without being CLIA certified. So everybody out there watching, Guamanians, you have the peace of mind knowing that we are properly taken care of. Our friends at the federal government have made sure and they have signed off on the fact that the fine folks here know what they're doing. Alan, I do have a question for you right now. You're a man of science, clearly, but you're also a resident of Guam. When you do these tests and if a particular sample should test positive for dengue, how does that make you feel? Because indirectly, you are still affected by this. You know, this could be a disease that could affect, you know, perhaps yourself, your family, your neighbors, and everything like that. How do you feel when you're running these tests and something tests positive?
Well, when I have the first samples that I tested, it's an imported case. So I'm already looking that somehow with our geographical area that I'm testing on it, Palau was hit, CNMI was hit, Yap is hit, and Guam is in the middle and is the only one not yet. So when the two samples that imported came for positive, I was like, I really need to prepare. Somehow, it will happen in Guam. So, but we're so lucky we are prepared for the testing.
Because when you go home and take off your lab coat, you're just an average citizen of the island. Like I said, this
Yes.
could affect you as well.
Yes, I always put these signs to all my. It's your safety 1st. You know, like whatever I do here, I think about my family that I will not bring the virus in my home. So I really make sure that my safety is important here.
Can you walk us through maybe some of the some of the other facilities you have here, and maybe some of the procedures that you go through when these tests are being done?
So maybe I can, since I'm not running anything, maybe you can glance this one.
Okay, so Alan's actually taking us inside one of the. Is this one of the clean rooms, Alan?
This is the extraction room.
Okay, the extraction room. Thank you.
This is a BSC2 cabinet. And this one, when it's on, whatever you're processing inside will not go outside. It's filtered. So the intake, it's only going in, not going out. So whatever you open there, it will just keep processing and it's filtered. And this one is yearly inspected, that it pass all the qualification to be certified. And then the other room,
And immediately to our left,
yeah,
that's the clean room, right?
and that's the clean room, and we don't allow anybody to enter there unless the technicians is doing it.
How many technicians per room and everything? Because this is a very small. There's a very limited amount of floor space here. I'm thinking you can maybe fit maybe 2 or 3 people in here comfortably to work.
Usually when we work, it's only one technician in each room.
Okay.
So we process the samples here, we take the probe there, and then we go all the way to the PCR room. So it's a manual processing. So you extract the RNA and all the way to the other side.
How proud are you of your team here, your unit, and also of the agency at large of public health and being able to respond to the dengue crisis that we now face and everything like that? What are your thoughts?
We are so lucky, even we are so short in manpower here in the laboratory, but we can really respond to the dengue itself. Public health officials really, give us like any time that they call us, even at night, we'll come in and work to do all those testing, so we can respond.
Okay. Okay, so what else do we have? Obviously, there's a lot of equipment here. There's a lot of people who've gone through years and years of training, and obviously they're very dedicated to their mission. But what else can you show us?
The last one.
What are these things here?
Okay. These are the pipette tips. So whatever you are extracting on your samples, it comes from this one.
Okay. Thank you.
Okay, so you are, if you're just watching us right now, or you happen to be going on Facebook and you saw our video pass up, turn the sound on, everybody. Don't let this video pass you by because there's a lot of helpful information right here. Alan and his team, we are live at Public Health in Manila. We are at the headquarters about a week and a half ago. We brought you a very insightful live stream over at the Public Health Lab up in Derido. That is AKA the Mosquito Lab. It's just affectionately known. Here is where the actual samples will be tested for not only the presence of dengue, but other diseases. And maybe, Alan, on that point, what other types of illnesses or communicable diseases is this facility able to detect?
Just this room alone, we can detect influenza. We can subtype the influenza from H1, H3, H5 to H7. We can also do leptospirosis here. We can also do chikungunya, Zika, and the dengue serotypes on this room alone. Yeah.
That's quite a capability. When you talk about this room alone, though, what can the rest of the lab do? Is there any other diseases that you guys can test for outside of this lab?
On the other side, we do TB tests in which we can do the nucleic acid amplification. So on the other side, we can do HIV, we can do syphilis, RPR, antibody screen. We can also do Hansen's disease, leprosy, on our side.
These are very tenuous times right now. I would say from an administrative standpoint, from someone being in charge of this part of the agency and everything like that, how do you keep your staff motivated, and what would you say to their level of response thus far?
Well, I'm very thankful that I have a great team. I've just started working here since 2015, and since then we've been able to, they're self-motivated, so I'm here to just support them and to give continuing guidance and have collaborations with other administrators of other labs and the public health lab associations worldwide. So in collaborations with them and with PIHOA, WHO as well, we all support each other, and so we support each other and guide through all the testing procedures that we want to develop or to validate. And we have samples that we actually asked Hawaii State Lab, we work closely with, and validating this dengue serotyping. It not only our team but other management teams, and so they were valuable and beneficial to us and helpful for validating our dengue serotyping with the specimens that they ship to us to validate positives.
Okay, well,
and negatives.
that's a very good leader. That's a great manager. But I would say, as a member of the Guam family, as a neighbor, as a fellow Guamanian and everything like that, what can you say to the people beyond watching this right now? Because we've been dealing with a lot of facilities that people will never see. There's a lot of acronyms that people will be like, wait, well, CIDA.
Yeah.
What should people just know in general about what their Department of Public Health is doing for them and where we are right now with the dengue crisis?
Well, with the dengue crisis, I'm very proud to say that Department of Public Health, under the direction of Director Linda DeNorsi, we've been able to really catch on quickly. Prevention is the key. Everybody wear their mosquito bracelets, and prevention and detection are the two very important part of an outbreak, of controlling outbreaks, and so that it won't go beyond the thousands that are happening in our Pacific region. We are very blessed that we have this public health laboratory, and that the island should know that we're taking care of all of you, and we're doing our best and working really hard beyond, we've worked 24 hours. Ask my family. They don't see me anymore, but hopefully.
Well, they're watching you right now. You want to give them a shout out? Hi, family.
Hi.
What village are you from?
Santos family, Barragata Heights.
Okay, not too far away. Yeah.
Not too far away.
What's up, Santos family?
And cleaning your areas, really, prevention, and hopefully we don't have to test your blood samples, so that prevention is key. Clean your homes and your areas, and just keep safe and indoors. That's all. We're here to detect and run your tests, but hopefully you don't get to that point.
Yeah, and they're taking care of us and everything, but it truly does start with us, the community, right?
Yes.
Following the directions, reading the advisories that public health and civil defense puts out and everything like that, because your team is doing an absolutely outstanding job, doing a lot of work. This isn't the kind of work you want them doing, though, ladies and gentlemen. They are scientists and everything like that, but let's try and get that dengue number down as low as possible. Let's get it back to zero, because it's the first time in 75 years, like I said a few moments ago. We want to have that space, again, but you guys are doing a fantastic job.
Thank you. Thank you so much.
Okay, well, what else do we have? I know you have a big facility here. Obviously, you've been very gracious in giving us some of your time and everything. So, either Alan or what can you tell us?
Well, as laboratorians, I'm always behind the scene, or we are, and so we're not very.
Is that how you guys are? I've never heard that word before, but that makes
behind
perfect
the
sense.
scenes.
Laboratorians.
Yes.
All right.
Nobody.
Did you guys know that's a word? Okay.
Nobody knows us here.
I've got some journalists who've been working in the business for 25 years.
Laboratorians, I guess, is what we coin ourselves.
Okay, tell you what. Okay. Then this is going out to the Santos family in Barragata Heights. Can you guys please out there watching on Facebook Google laboratorians and see if it gives the little squiggly red line of it. Okay, if you guys haven't signed up for Grammarly, if you're on YouTube, you're gonna see the ad a million times. See if laboratorians actually sets
I
Grammarly
created
up.
it just today.
Okay,
So
good job.
the laboratory people always create. They're innovative, creative, and we always constantly moving up and trying research and being just out of the box. Think out of the box, and what tests or can we validate, and what tests can we add to our test menu.
All right.
For detecting diseases, especially recently we've had the climate sensitive infection diseases opportunity grant application, so that we're also writing grants in addition to to keep up with the laboratory methods out there,
Okay.
the new technologies.
All right. Well, thank you once again for what you do for the community and for having us here today. This is most informative. So thank you, everybody, for meeting these laboratorians. We've all learned something here today. So please make sure to heed the warnings. Go on Civil Defense's website. Check out the articles we put on KUAM.com. We put lots of information how we can all steer clear of the dengue infection. Thanks for starting your day the KUAM way. I'm Jason Salas in Mingilao. We'll see you real soon.